Hi everyone and welcome back to ClinSci Explained. My name is Ian and I am a clinical psychologist working in the UK. And this series of videos is just trying to help you understand what clinical psychologists do. This video is all about your first session, so what can you expect if you are going to access mental health services. If you've watched some of my other videos, you know that I just flashed this up for a little minute for you to read. It's just a bit of a disclaimer about the thoughts and opinions expressed in this video. So if you're accessing a mental health service for the first time, it's quite unlikely that you're going to meet a clinical psychologist straight away. That's because many services are now moving towards assessment teams and or what we call single point of access teams. And this means that anyone who might have mental health difficulties can go to one place and be assessed by one team who know all the various types of support available in a local area. Going to an assessment team means that you'll probably be seen quicker. You won't be on a waiting list because it's just that team's job to see all the new people that are maybe coming through to mental health services, or those maybe kind of like returning to services after a bit of a break. So it means you can get seen faster and talk about the difficulties that you're facing. Also probably means that you get to see then the right person quicker. Might mean you'd have to go through another assessment, but generally after that short appointment, someone might have an idea about the best treatment option for you. Sometimes the assessment team need to make difficult decisions, such as discharging people, maybe because their problems aren't severe enough to meet criteria for a specific service, or maybe in that local area there aren't services set up to help with that problem that someone is experiencing. So when these difficult decisions have to be made, sometimes the assessment process can come under a bit of fire. Maybe someone would say that I wasn't seen for long enough, or you didn't listen, or I didn't feel safe enough to share things. Whenever that happens, I would always kind of like think that person's going to get the best service if they share as much as they can in that session, so that the person assessing, the clinician, knows all the information and can make the best assessment and the best treatment or best clinical decisions that they can. So when you show up for your first appointment, you're probably going to be met with a clipboard, a pen, and some questionnaires. Obviously, as well, hopefully you'll be met by a happy receptionist who will sort of let you know where to go and what to do. But you'll be met with some questionnaires, and these are screening tools to help us identify what the main problem is and maybe how severe the problem is. And once you've completed that, you would go into your consult with your clinician, and they might use the questionnaire to ask follow-up questions, but they'd ask other things as well. You know, like what's brought you here today, what's kind of gone on in your history, what are your plans for the future, and maybe other things that might contribute, like maybe what's going on at work or school, how are things in your family, are there any financial pressures, these sort of things that will all affect someone's mental health. And if we want to think about factors that affect someone's mental health, if you watch the other video on formulation, that explains a little bit more as well. So during your appointment as well, the clinician should also talk to you about confidentiality and consent. And I'll go into these two things in another video that you can watch soon. But basically it's around how information is shared. So whether things that someone discusses in a consult, whether that's private or whether things might need to be shared if there's risks involved. So you'll be coming to the end of your assessment. You've had a bit of time to fill in the questionnaires. You've been had a chance to answer some of the questions that maybe the clinician has had for you. And it's the clinician's job to start thinking about using all that information to then decide, you know, what's the best treatment? Can we help this person who's sitting in front of me? And they'll be going through in their heads maybe different treatment options, and hopefully, as part of a collaborative process, as in like joint two-way process, they'll start talking about the various treatment options that might be available, so that you can have a bit of a think about, what fits with you and what your commitments, either with work or school or maybe your personality, and what types of therapy or medication or whatever fit with what you want to kind of get out of your visit. As at this point as well that you'll probably complete a care plan, and a care plan is just a written agreement about what you've decided from that consult. So maybe you've jointly agreed that you don't need some sort of help at the minute, so you might agree to be discharged, or you might agree that some self-help literature might be what's going to make the difference for you, or you might agree that a therapeutic option like CBT, cognitive behavioural therapy, is the thing for you. And this is something that you jointly agree with the clinician, and you sign up to it, and this goes in your care records. And the way that I think about care plans is that they can be ripped up, they can be added to, and they should be an agreement. They're not just for us to have in our records, they're for you to take away and think and use, that if we as mental health professionals aren't doing what we said that we were going to do, you can give us a kick up on the backside and say, look, like 2 months ago you said that we were going to do this and we haven't done it, why not? So it's to be used for both people accessing the services and the clinicians themselves. And that's the end of your first consult. So hopefully everyone agrees to the plan that you put in place. However, we know that first appointments can be quite stressful and nerve-wracking. So there are some things to maybe think about before your first appointment, before accessing an assessment team. Maybe consider taking a friend or a family member along, and although they might not always be able to kind of come into the consult room with you, they might be okay waiting in the waiting room, and that might give you the reassurance that someone's there to support you. Try writing things down as well if it's really important to get all the information out, so that it helps your memory and you don't forget anything. You don't want to be leaving and thinking, oh, I wish I would have said that, or I don't agree with the plan because I didn't sort of say this. Again, like sharing all the information is really important. It can be a bit strange going into a new place with a stranger and just offloading everything. And there's some really personal things that we might not want to mention. But if you think about it from the clinician's point of view, if you don't have all the information, you can't always make the best decisions. And so try and share as much as you can. And those sort of things might help reduce stress. Also, if it's a really sensitive appointment and maybe you feel yourself getting overwhelmed, try having a little break about halfway through. That's fine. You can build it into the time, and if it helps complete the appointment and share all the necessary information, I'm sure the clinician's going to be happy with that. That's fine. So that's it for a video about your first appointment. Some of my other videos will go on to other areas like the various therapy options that you might access, but those are for another time, so keep an eye on this channel. If you want to contact me, there's going to be details at the end, or you can follow me on Twitter at whatisclinsci, and the address should be right here. And hopefully see you again for one of the other videos. All right, see you soon.